Good afternoon, everyone, and welcome to this series of webinars of the Trust Stroke project. Today, we have the pleasure to have one of our partners is the Nacar design agency. We'll talk about the stroke patient experience and reveal behaviors, patterns, and guidelines for stroke treatments. Next slide, please. Okay, for those who are not familiar, Trust Stroke is a European-funded project aimed to develop and validate a reliable AI tool to predict and improve the outcome of stroke patients, focus on ischemic stroke patients. This is a very strong and cohesive partnership, a consortium of more than 13 partners from 5 European countries, and the duration of the project is of 4 years, from 2023 to 2027. Next slide, please. So, as you can see in this slide, Trust Stroke articulate different solutions, including federated learning infrastructure to ensure AI robustness and trustfulness, and also the development digital platform for patient follow-up or collecting outcome data, and also will develop a proof of concept of this solution, of this platform. All this integrated solution will help us to improve the risk assessment of stroke prediction and outcome. And also, we plan a continuous upgrading and continuous learning with this flexibility and scalability of the platform. Next slide, please. So now I hand over to the Nacar team to share the experience on this topic and what they are doing in our Trust Stroke project. Please, Carmo or Carolina?
Yes, thank you, Carlos. Hello, we are Nacar Design. I'd like to first extend a warm welcome to all attendees of this webinar and express our gratitude to Carlos and the entire VHIR team for their setup and support. Before we dive into today's session, allow me to introduce ourselves. We are a design and strategy agency equipped with a multidisciplinary team of designers offering expertise in the following services: digital design, industrial design, and service design. Today, joining me, Carmo Requejo, in the strategic coordination of this project are the members of the user experience and research team. We have Carolina Lauzen, our user experience designer and project manager, and Javier Tejedor, a user experience designer. In today's webinar, we'll delve into research conducted for this project, focusing on stroke patient experience. We will unveil their behaviors, identify patterns, and discuss guidelines for stroke treatment adherence. We will cover the following topics: what is our methodology, how to understand patients' behavior, how to identify patterns, how to enhance the patient experience, what have we learned, and what is guiding the design decisions. Let's start. What is our methodology? So the design process that we follow, the methodology we use, is the design thinking in a collaborative process of diverging to explore and converging to make decisions to finally design a digital solution, an app. We start by the discover phase, where we research and gather data, followed by the envision phase, where we start conceptualizing the idea. Next is the materialization phase, where we explore and prototype the solution, and finally, the implementation phase, where we start implementing the solution. In this webinar, we will present the discover and envision phases, covering topics such as ethnographic research, data analysis, and design strategy. So how to understand patients' behavior? We begin conducting user research, as the patients will be the ultimate users of the solutions to be developed. The objective is to get known the users, the patients, understand the needs, goals, preferences, pain points, motivations, and behaviors of the target audience. To build empathies towards the patients, to adopt a patient-centric approach, and to identify opportunities for improvement. For that purpose, we conducted ethnographic research consisting of qualitative in-depth interviews with the patients and some contextual observations. We conducted a total of 24 interviews comprising 4 online sessions and 20 in-person interviews across different hospitals in Barcelona, Spain, in Rome, Italy, and in Leuven, Belgium. These interviews involve patients with diverse demographic profiles, including variations in age, language, social background, and environment. Here are some visuals from our research, showcasing the wearables they use, the medication and the methods for remembering them to take them, the most frequently apps they were using, and some of the notes they were taking. I will now pass the presentation over to Carolina to continue.
Thank you, Carmo. Good afternoon, everyone. I am Carolina, and I will take over from this point. So to build up on the information that Carmo has already presented, the next step was to build the patient matrix. This matrix has helped us to compare the different behaviors of the patients. So what did we do? At first, we identified 2 relevant variables that were important, right, for this project, which is trust stroke. And each one of these variables will correspond to one of the axes of the matrix, right? So now we first start with the vertical axis. This vertical axis represents the patient engagement. So if we look from the top to the bottom, we see that patients that are methodical and impulsive and strict shall be placed at the top of the matrix, followed by the ones who are obedient, pragmatic, and from the center of the matrix going down, we have the apathetic patients, passive ones, right? And at the bottom of the matrix, the disconnected, the distracted ones. The other axis is the horizontal axis. And for this one, we chose the variable of their capability on using the mobile phone. Why? Because since we are designing a digital application, it is important to understand the level of capability that they have when managing mobile devices. So if we start looking at this matrix from right to left, we're going to see that the proficient and heavy user patients will be placed on the right side, followed by the moderate users, limited users, and on the left side, the non-users, meaning users that can also not have a mobile device. With the matrix constructed, with the matrix built, we start placing the patients that we have interviewed according to what Carmo has explained before, the 24 patients that we have interviewed, we start placing them in the matrix according to their engagement and the level, the capabilities of using the mobile phone. So here we see all these 24 patients. We have mapped them in different colors. So we have the blue colors, the blue dots for the Valdebron patients, the green ones for Agostino Gemelli, and the red ones for UZ11. Now, if we focus on the patients that came to the interviews with caregivers, these would be the ones. And now, if we go on, we have also mapped these caregivers, the caregivers of these patients. And here in this slide, what do we see? We have drawn lines to connect the patients to the caregivers. And what can we see here? We can get an important conclusion from this diagonal that appears here in this matrix, which is that although the patients can be spread throughout the matrix, the caregivers, in this case of this research, of this sample that we got, the caregivers were always positioned on the top right quadrant, meaning that they have skills on the use of mobile devices and also that they are engaged. What are other discoveries that we reached about patient and caregiver behaviors? Here we have listed some of them. So the first one I'm going to go through is that not being a frequent smartphone user is not only related to age. It can be a matter of rejection, meaning lack of interest, or cognitive impairment. Another one would be that not being engaged to the treatment is not only related to physical impairment. Cognitive impairment, apathy, and lack of interest play a big role. And the last one that we have listed here explains that caregivers can be highly committed in enhancing the quality of life of patients, and they can push for the engagement of these patients. Now, moving forward, how can we identify different patterns of behavior? This is a result of our user research. So first of all, what we do a data analysis with all the information that we have collected during the user discovery, right? So our aim here is to cluster similar data that will inform us on the distinct patterns. So we use different methodologies to do this, such as affinity maps, experience flows, journey maps. And as a result of this data analysis, we identify the different patterns of behavior, right? And these distinct patterns will be translated into what we call the user personas. And what are the user personas? Why do we develop user personas? So the user personas, they help us to focus on the target user, right? Because remembering people is much easier than memorizing raw data. So they promote empathy and alignment among the members of our team, the members of the design team. Also, they help us fight against the concept of one size fits all, because as we have different patterns, we know that they have different needs, different motivations. So they don't behave the same, all of them. Not our target, all of our target audience behaves the same. Okay, so for this project, for the Trust project, we have identified 5 different user personas. And this is how they are spread through the matrix that we were presenting before. We are going to go through each one of them, presenting them, right, more in detail. And we're going to start by the green one on the right side. So this user persona represents a patient that is engaged and has skilled in the use of mobile phone. So here we present you to Laura. Laura, we have called her the practical. And now let's hear what Laura has to say about the recommendations she receives from her doctors.
I am very obedient. I know I shouldn't smoke and I don't. It's more a matter of mindset than anything else.
So we can understand that Laura is the type of patient that follows the instructions received by the doctors, right? She can make a good use of digital devices. She's connected through a mobile phone. Also, she uses the computer. She's someone that is committed, meticulous, right? And her goals are to be consistent with her treatment and to follow the doctor's recommendation. Also, in the same quadrant, we have identified another user persona. And this one is Luis. Luis is the challenger. Now let's listen to Luis' testimony about how he deals with his recovery.
I'm highly methodical and strict. I'm always pushing forward.
So Luis is the type of patient who is extremely concerned about his treatment and about his condition. He is heavily connected. He makes good use, very good use of mobile phone, of computer, and also he wears a smartwatch. He is highly committed, highly meticulous, right? And his goals are to discover new technologies and treatments for resuming his previous life, and also to obtain detailed information from doctors. So we see that this patient is a more radical type of patient, right? Now moving to the left side of the matrix, we're going to talk about a user persona that is engaged, but doesn't have skills on the use of a mobile phone. Here we present you to Maria. Maria, we have called her the cooperative. And let's hear what Maria explains about having a stroke recurrence.
Of course, I'm afraid it might happen again. I'm doing everything I can to prevent it.
Right, so Maria is a patient that is also obedient and committed, but she lacks capability to use or to manage mobile devices. So she has very limited use on these type of gadgets. She is the one who prefers that old school phone calls, right? But on the other hand, she's someone who wears a smartwatch. So she's also committed, she's meticulous, and her goals are to have follow-up visits in person because video calls do not work for her, and to get recognition for blood pressure measures by her general practitioner. Now we are going to move to the bottom part of the matrix, and we're going to talk about a patient that is that doesn't have a skill with technology, with mobile phone, right? And is not engaged. We present you to Carlos. This is Carlos. Carlos is the evasive. Let's listen to Carlos' testimony about his treatment.
I don't think it's good to take so many pills. Over time, it will be bad.
Right, so Carlos is that type of patient that is rebellious, that is skeptical about his condition. So he's a non-user of mobile devices, and he is someone who is indifferent about his illness, about his condition. So his goals are to maintain the pre-stroke bad habits, such as having a daily beer and keeping smoking, and to live life as if he hadn't had any health problems. Now moving to the right side of the matrix, on the bottom part, we will present a patient, a user persona that is skilled on the use of mobile phones, but is not engaged. So here we have Julia. Julia is the passive. And let's hear what she has to say about her treatment.
My husband is my alarm to take my medication. Without him, I wouldn't do it.
So Julia is the type of patient who needs someone pushing for her all the time, someone nudging her. we see that although she makes good use of digital devices, right, of mobile phone, of the computer, she lacks interest in health applications. So she's someone who has a chaotic, let's say, a chaotic behavior. Her goals, her goals are to avoid stress, avoid pressure, and always have her husband to continue to be a support and caregiver for her. And here we see a summary of the 5 user personas developed for this project and how they are spread throughout the matrix. Now let's take a look on how each one of these user personas, what is their attitude towards a stroke recurrence. So we see here that in the right top side of the matrix, Laura and Luis, they are the type of patients that take actions, that are proactive. Also, Maria, she's also this kind of patient, and apart from that, she's someone who searches for support on issues, on matters that she lacks capabilities. For instance, technology, right? Now moving down, we see Carlos, and Carlos is that type of patient that tries to avoid his condition. And Julia is someone who gets paralyzed by fear and does not take action. Now let's go quickly through another useful tool that allows us to visualize the flow that the patients follow after having a stroke. So this tool, which is called the journey map, it serves us to inform about the actions that the patient takes, the friction points, and many other variables. In this case, we have built a patient journey map for patients who have had a stroke. So here it's how it looks like. It looks like. I know that you cannot read it from the screen in detail, and this was not the purpose of this presentation, of this slide. It is just to give you a general overview of the patient journey map that we have developed for the stroke patients. So we see that it is divided in stages, also in different moments during each one of the stages. We also see that we have detailed all the actions that the patient performs during each one of the stages. We have mapped the different stakeholders that are involved, the pain points that these patients suffer is to say the friction points during this journey. And here at the center, we see the emotional curve of the patients. And we can see that from the hospitalization stage on, this curve splits into 2. The green curve refers to patients that they're positive, they are motivated about their treatment, about their recovery. And the red curve below refers to patients that are more negative, they are not motivated, and that probably lack support, or are feeling depressed. That said, I will now give the floor to my colleague Javier, who will go on presenting other interesting topics of our design process.
Okay, so first of all, thank you everybody for being here. Let's going to cover now the part of what we call design strategy, and we start by these questions. As it's how to enhance the patient experience. As we are designing an app, so it's very important to define now after the analysis a strategy that can follow us, that can guide us to the design part. So let's going to cover this into this phase. And the question we had after the analysis was how might we enhance the patient experience? So that we split it up in 2 challenges. The first one is we can do that by facilitating the collection of data from the greatest number of patients. That was one of our answers and one of our challenge. And the challenge number 2 is by improving the patient's adherence, also we can enhance the patient experience. So now we are going to move into each of these challenges, and we are going to cover per each of the users that we already shared with you. So let's start by the first one, which is facilitate the collection of data from the greatest number of patients. So why this is important? So the aim for this challenge is to collect the biggest amount of data from the patients. So, and why is this important? Because basically these data are going to feed a model of artificial intelligence that will predict the clinical worsening, the unfavorable outcomes, and also the recurrence. So basically the data from the patients are going to help us and to help the model of artificial intelligence to understand the prediction of the patient's health. And this is quite important. How can we cover this challenge for each of the patients we already shared with you? Let's go into see right now. So for the first one, if you remember on the matrix, on the top of the matrix, we have Laura, which is the practical, and Luis, which is the challenger. So for these patients, it shouldn't be difficult because their profiles are already engaged with the treatment. I already engaged with the medical instructions, and they don't have like technical limitations, so they can use mobile phones like fluently, let's say. The recommendations for this patient is that the solution should be useful and provide them with an added value. They need to perceive the added value that the solution, that the app in this case can provide to them. And this is the recommendations for this patient. If we move to the other one, in this case for Maria, the cooperative, which she was like at the top left of the matrix, this profile is very likely to follow the medical instruction, but the digital gap can hinder the collection of the data. Basically, this user maybe sometimes she doesn't know how to proceed with the technical things, with the technical apps, with the technical stuff. And for this kind of patient, the recommendation is use transition design to facilitate the digital access. So we need to be sure that our design facilitates the digital access for this kind of patients. Also, we can count on the caregivers for this kind of task that involves technology somehow. So it can be maybe a daughter or a sister or somebody that can play an important role. And also we can collect more data if we use the wearables to connect these patients with the app. So basically it's going to be a process which is automated and it's going to be easier for the user. So if we move now to the Julia, which is the passive, so Julia is unlikely to follow the medical instructions well. If you remember, Julia was on the bottom of the matrix on the right side. Basically, she has technological skills, so she can use a phone, but she's not engaged on the treatment. So what are the recommendations for this patient? So basically, count on the caregivers to monitor and guide the patients through the collection of data. Also, the solution should be simple, practical, and easy to use for this user, not only for this user, for all of the users, but for this in particular, it's something really important. And also the solution should nudge the patient behavior. It's going to be like a kind of trigger for this patient to use the app to collect the data. And what happens with the last one? So Carlos, the evasive. So this is a challenge because this profile is very unlikely to follow the medical instructions. And also he has like very limitations to use the mobile phone. So this is a really challenged patient. And the recommendation for design is to count on the caregivers to monitor and guide the patients. So the caregivers here are going to play a really important role, and also facilitate this collection of data with wearables. So they can automatically feed the application with these wearables such as smartwatch, or these kind of things. Okay, if we move now to the challenge number 2, which is improve the patient's adherence. So the aim of this challenge is to reach the different profiles through providing a tailored solution so that will fit their distinct behaviors. This is basically, as Carolina explained before, because we don't want a solution that fits for all, we want a tailored solution. So in this case, to improve the patient's adherence for these patients we have here, which is Carlos and Julia, the special challenge for these users is to increase the engagement. So basically, if you remember, they are positioning like in the bottom of the matrix. So the intention with the design of the application is to move them to the top of the matrix, to engage them somehow. So basically, this is the movement we are trying to cover here. And what are the recommendations? So basically, for Carlos, is to be monitored and guided by the caregiver. So again, the caregiver here is going to be like the main role to make Carlos more adherent to the treatment. So basically, the adherence is going to be from caregiver point of view. And what about Julia? So for Julia, the recommendation is an easy-to-use solution. Basically, we need to build this kind of solution here with some automatic functions. So she doesn't want to think about the app. So an automatic functions in the app could be really useful for them to avoid the effort to input some data or to make the patients more adherent. And also here, the caregivers are very important for this role, which are both on the bottom of the matrix. What about the others? What about Maria, the cooperative, Laura, the practical, and Luis, the challenger? So basically the ones that are on the top of the matrix. The goal for these patients is to keep their engagement and feed the predisposition. So these patients basically are eager to keep involving in the treatment. So they are adherent and they are following the medical instructions. But what can we do for some of them? As you remember, they are here in the matrix. So some recommendations. For Maria, which was on the left side of the matrix, so basically she has some difficulties with the technological skills. So we need to design a solution that requires minimal effort. Also, we need to facilitate the connection with wearables. And for Laura, which is a practical, we need to personalize the app. And it's the same for Luis, the challenger. But somehow it's going to be covered in a different way. But the personalization is a factor that it's important for both of them. So what have we learned so far? What are the main takeaways that we cover by thinking and doing this phase? Is that the caregivers shall also be regarded as end users of the app. So not only the patients, the caregivers plays a really important role, as I was explaining before. The benefits of the app shall be clear to the users. So all time the users need to understand what is the added value for using this kind of solution. Another main takeaway is the app shall be easy to use, personalizable according to the different needs and interests. So basically it's designed for each of them, of these profiles. And the last one is the solution will not be focused on making them more skills, not making the users, the patients more skills, but it will aim on developing an easy to use app. So basically for the cooperative one, we need to allow the patients with low technological skills to perform the task. So for the passive and the cooperative, we need to develop a solution that requests minimal effort, as they are not engaged and they are not tech savvy. And for the evasive and the passive, we need to allow caregivers to nudge the patients. So these are our main takeaways for this part, for the design strategy part. And now we are going to cover what is guiding the design decisions. And I left to Carmo.
Okay, so we're reaching the last part, and now I want to cover what is now guiding our design decisions. As now we are currently in the materialization phase and developing the final solution. So for this purpose, we have established the design principles for the solution. The design principles are a set of considerations that form the basis of any good product. They are fundamental guidelines that inform the design process and help ensure that the final product or solution meets user needs and business objectives effectively. These principles provide a framework for making design decisions and aligning the design with the goals of the project. So which were the design principles? The three design principles that we have established for the app design that we are developing. Those are trustful, inclusive, and useful. Trustful relates to perception. It's regarding the relationships the patient establishes throughout its use and the app look and feel. It's through human connection, reliability, communication, and information. Then inclusive relates to relates to integration. It's regarding people, the patients, the whole ecosystem, and platforms integration. Is through different needs, multiple profiles, and unified platforms. And the last one, useful, relates to benefits. It's regarding functionalities created and its performance through the ease of use, proactivity, and efficiency. Now, after presenting which were the design principles and all the process, let's see if there are any questions from your end regarding the presentation. I'll invite now the rest of the speakers to join me, and we'll see if there is any question that attendants want to be answered.
First of all, thank you very much, Nacar team. Thank you, Carmo, Carolina, and Javier. Wonderful presentation, very insightful, and also very comprehensive, and give us a full vision of how Nacar design is doing the job in process stroke, just adapting the solutions to the patient's behavior and in developing these patterns. It's very interesting. So to me, I don't see any question for now in the chat. Please add your questions in the chat. I have some questions for you. The first one will be, it's attractive, the idea to predict these behaviors from the very beginning. Once the patient is in the hospital, before the patient is discharged, it would be great to identify easily those patterns, especially those evasive. I disagree, Carlos. Carlos is not evasive.
Sorry for that.
Thank you for that. But anyway, so it's how to identify those patients who will benefit from intervention. Probably AI may help us with a high volume of data from different sources, so we can identify easily those patients and get an alarm, how to start implementing those interventions as soon as possible before even patient is discharged, and customize which is the essential of this task, the customized intervention. How do you see that? How do you foresee? Is that possible to create like a score or a simple scale to identify those patients who will benefit from further interventions?
Well, the aim is to start doing that with having them previously profiled, like of course that I imagine when the patients go in and without really having the possibility of interacting with them, it will be very difficult to understand how they are. In this case, as it is for also the prevention of second stroke, if there is already any predefined profile in the hospital, it will probably is easier then to understand how to act with each client, with each patient, sorry. So also during the first days while in the hospital, it's the opportunity for the people that interact with the patients, the case managers or the doctors, to understand there's always this initial feeling that of course needs to be validated, but to help to understand how is the ecosystem, the family, how is the reaction towards what is being told. And eventually artificial intelligence will help on giving us better matches to our initial hypothesis, no? That initially it's just hypothesis. I don't know if you want to.
I think
Just
will
say
be
that
important to
it could be establishing a screening for the patients before using the app, right? So that we first identify their profiles before they have a first contact with the app. That would be it.
But what type of screening would you propose?
We need to establish a score, right, to each one of these patients, define questions to identify their behaviors, right, and then according to the answers, they will have a score, and then we will be able to identify these profiles.
Yeah, and also I think it's important to standardize the variables that are going to be collected once the patient is discharged to feed the algorithm. We plan to develop an algorithm to enhance treatment adherence or to predict the risk of poor treatment adherence based on these personas, these patterns you showed. So I think it's important to standardize for all centers the data, the main data that you collected. Most of them I know it's not just the structured data, it's just the input you receive from this sample of patients. Maybe a larger samples of patients will give you more insights, for instance, demographic data, probably some areas for instance, in Lauzen, there are more rich areas or wealthy areas, with more digital skills than close here in Barcelona, for instance, in some neighborhoods that are less wealthy. So this is the things that we need to explore more. And I think we have the opportunity in this project to run this kind of studies and to also to enrich the algorithm, the training of the algorithm that way. Another question that I have that got my attention was the personalization, this high profile. So the practical and the challenger. So they don't need more. So they are good patients. They are too good to be there. Actually, we don't understand why they had a stroke. So they even perform, they had a good primary prevention. But what is the adding value, the benefit of personalization in this group? Because they look like they are on the top, and we are just pushing to be even better. So it's gonna help them or feel more comfortable with the application. What are your thoughts?
Yeah, somehow what we were talking about with the challenger, so as you mentioned, so these are patients that are already engaged with the treatment and with the medical instructions, but still they need to perceive the added value by using the app. So this is always important to keep the patients engaged to the application and to keep the patients engaged to input their data, which is basically the core of this app. And for this, in case of the challenger, we were thinking about some personalization regarding the features that they can see. This kind of patients, as Carolina was explaining before, so they are more into data, into know exactly the reasons behind. So they are more somehow doctors, let's say, so they want to know the reasons. And that's why personalization in this way can be really useful for them. And regarding the practical, maybe as they are practical, they don't want to see everything. They don't want to see all the data, all the numbers. So they just want to use the application as much easier and as quicker as they can. So that's why also we need to think about how to personalize the app to keep these patients engaged, which is the core for this.
I would like to add something here also, just a compliment, is that we know through statistics, right, Carlos, that the engagement of the patients tend to decrease with the time. So it is very important that to keep them motivated. And this is what this type of personalization looks for, right? To show them the value added to the app and keep them engaged in the treatment.
So actually your response linked to my next question is what to deal with post-stroke depression. As you know, 26% of all strokes are depressed due to a stroke. It's not previous to a stroke.
Yep.
They are depressed right after stroke. So mostly in women are more depressed than men after stroke. It's a consequence of a stroke. So how it can affect these patterns, these personas. So a persona can change over time as long as we identify depression, we treat depression, maybe the response you receive from this persons is different, right?
Yes, and this is the yeah. I'm sorry.
In the screening of we have that. Nora will collect this information about depression. So how you incorporate this information in your personas stratification?
Yes, this is an important topic, Carlos, because it refers to one of the core functionalities of the application, which are the PROMS questionnaires. Through the PROMS questionnaires, it is possible to identify if a patient is suffering from depression, and then try to act as quickly as possible to enhance the situation, right? Questionnaires, the PROMS and PREMS questionnaires is a core function, as I said before, is a core functionality of the application. And the aim of this, one of the aims of the questionnaires is trying to detect the depression status of the patients and trying to act fast to avoid it or to help this type of patients.
Is there any other question or comment? I don't see any question in the chat. I'm back to Carlos, the evasive. Well, I think it's one beer, a daily beer is normal. It's not that something that is, you have to take it. There is a question here. So how will we reach patients that cannot use the app?
Yeah.
Robin does.
Yeah, so on the different situations and through the metrics, of course, each patient has a different situation, and some that are not able, whether if it's because they have not the skills to do it or because they had any problem that derivated from the stroke that prevents them from interacting with the apps. So usually they rely on a caregiver. It's then the caregiver that will make that the part of inputting and controlling and putting the information and also receiving information from the app. Now, so there will be this relationship, as Carolina showed in the matrix, of then the caregivers that will help and need to provide this assistance to the patients. Of course, that if that doesn't exist, there is still the case managers and the hospital healthcare professionals that are already doing the assistance. Now, this is a plus to continue and to provide a more powerful way of the patients to be able to receive and provide information. No, for the ones that have no means of doing this, the usual and the classical systems is still there for them. But of course, that when being able, whether if independently or with the caregivers, it will help them to have a better information and to provide also information.
One other thing, so I see that now Robin, yeah, go ahead. Okay, I would now have seen that Robin was mentioned about if somebody else is going to fill this information, so it's need to be clear that this information is given by the caregiver. And that's why during the exposition, we were thinking not only design for the patients, but also design for the caregivers. And here in the app, we were thinking about having different roles, different user profile, let's say. So we have the caregiver and the patient. And in case that the caregiver is doing the actions, it needs to be really clear that is the caregiver who is doing this. So this is another way to be transparent with the patients, the families, but also the hospitals.
Yeah, I think it links to the next question from Robin also about we need to clarify the answers come from the patient or the caregiver. For sure, this is different. You know, the perception of the caregiver compared to that from the patient is completely different. And David Brown also is asking, so is there room for interaction with other technologies such as QR codes or NFC, which make it easier and less techie-savvy patients? For instance, in NORA, there is a code bar viewer, so you can just approach the phone to the box, and you know if the patient has taken the medication or not. And there are other solutions also integrated in the application that easier the management of the data collection. But it's true, there are other technologies that can be integrated, so and easier and facilitate the capture of data for sure.
Yes.
Yeah, and also, for example, the smartwatches, the wearables plays also an important role for this, for data collection. Could be also added to the QR codes or NFC technologies also.
Yes, just to clarify that the final solution is still under construction, David. So this is why we cannot reveal it, but we have all these things in mind when finally designing the final solution.
Yeah.
And thanks for your question.
One more? No, there is no more question. Just thank you from Sarah. You're welcome, Sarah. So thank you very much. Great presentation, great discussion also. So with that, we close this webinar, just reminding you that the next webinar is going to be at the end of May. Nora will be in charge and further question will be answered in that webinar. It will be the 31st of May, the last day, the last Friday of May. I invite you, all of you, to join this webinar. So it's growing, and I think the knowledge that we share in the consortium is improving. I actually super happy and excited in how it's going. So how we are closer and closer. We have just had this morning a meeting with other related projects founded by Horizon Europe in artificial intelligence in healthcare, and we found similarities and different similar barriers, and you know. In the future, we are planning to invite those other projects like Transport to join and learn from these difficulties and also the case success that they found in their approach and implementation of the project. So thank you very much, Nacar, for the presentation. Thank you all for the discussion, and see you all in the next webinar. Have a nice Easter holidays. Bye.
Thank you.
Thank you. Bye-bye.
Bye.